Um, my name is Bryce Davis. This is my second public education video for my Intro to Philosophical Ethics class. I want to start by discussing some topics we went over in class. The topic that I would like to discuss first is euthanasia or mercy killing. First, what is euthanasia or mercy killing? Euthanasia is the act of killing someone who is in a lot of pain and suffering, either from illness or an accident. The reason why it is controversial and illegal in some countries is because the act of killing someone or murder is perceived as morally wrong. On one hand, people who are consequentialists believe that letting a suffering patient die is best because it lessens their pain and unhappiness. People who are Kantians view letting a suffering patient die is respecting their body autonomy by allowing them to make the decision for themselves on whether they want to live or die. There's also a discussion of active euthanasia versus passive euthanasia. Active euthanasia is the direct killing of a patient. Passive euthanasia is just letting them die. Euthanasia is based on conditions, such as if a patient is in terrible pain and suffering and there's no relief. Or if the person wants to die and they and the people who care for them are informed and it's agreed upon that the person would be better off no longer living. Now, some people object to the practice of euthanasia. For example, with today's modern medicine, some believe that pain can always be controlled. So there is no need for euthanasia. Also, there are some people who believe in miracles. We've had cases when patients wake up from being in a long-term coma, and also there's those people who believe that euthanasia is just plain wrong, that we should never kill anyone intentionally, no matter what. Now, also, there are other concerns, such as what if you kill someone who really wants to live? And on the other hand, we're keeping someone alive who wants to die. And the term euthanasia means a good death or an easy death. Now, there are two methods that applied ethicists use when they are analyzing ethical issues. Now, the first method is an argument from analogy. An example would be the issue of abortion and comparing it to an analogy of a kidnapped person being attached to an unconscious person for 9 months. And rather, this person is within their rights to unhook themselves from that person. The second method that relates to the topic of passive euthanasia is the bare difference argument. The bare difference argument is used to determine if there's a moral difference between actions. Now, in the case of euthanasia, we can ask the question of if there's a moral difference between killing someone and letting someone die. Passive euthanasia is used to reduce suffering, to alleviate it. So, however, active euthanasia is more effective in reducing suffering than passive because death would come quickly. So when passive euthanasia is justified, does this mean active euthanasia is more justified? Is there a moral difference between the two? So, in conclusion, this is a relevant topic that any of us can encounter one day. Consider the racial disparities where African Americans are at higher risk for chronic diseases such as heart disease, stroke, cancer, HIV, AIDS. And it is essential that we think about the answers to these questions because one day we may have to make these decisions for ourselves or a loved one. Thanks for watching.